Buzzwords, patterns, and automation. How your brain scores points for you on step 3. Let's do it. Step 3 is not an exam of random facts. It's an exam of automatic clinical reasoning. Buzzwords, patterns, and familiar clues that unlock your brain's natural ability to process information. This episode, which is fairly comprehensive, reveals how your brain is wired to recognize patterns, how you can train that ability like a muscle, and how step 3 is designed to reward your clinical intuition. Master this approach, and your brain will start answering questions before you consciously realize it. The real reason buzzwords exist. Buzzwords are not gimmicks or shortcuts for lazy students. They are the NBME's way of testing whether you can function like a real physician in high-pressure, time-sensitive environments. In actual clinical practice, you don't sit there building a 10-item differential on every patient who walks through the door. You don't relearn the basics of chest pain every single time someone presents with substernal pressure. You don't slowly analyze whether a patient with a fever and hypotension might possibly be septic while they deteriorate in front of you. Instead, you use patterns. Your brain recognizes a familiar cluster of symptoms and immediately jumps to the correct conclusion. This isn't cheating the system, it's pure biology. It's how expert clinicians develop their clinical acumen over years of practice. And it's exactly what the exam is designed to test. The NBME knows that pattern recognition separates competent physicians from those who will struggle in real-world clinical settings. Real practice, reality. You don't have time to analyze every detail when patients need immediate care. Time-sensitive issues do exist, and you need to be up to the task. Pattern recognition is your brain automatically clusters symptoms into familiar diagnostic patterns, clusters of symptoms and signs. Instant action. Expert clinicians move from recognition to intervention without conscious deliberation. This is what we are trying to achieve here. How your brain actually solves medical problems. Understanding the cognitive science behind clinical reasoning is crucial to master step 3. Daniel Kahneman's groundbreaking research identified 2 distinct systems your brain uses to process information. System 1 operates automatically and quickly with little effort and no sense of voluntary control. System 2 allocates attention to effortful mental activities that demand concentration and deliberate analysis. Medicine requires both systems working in harmony, but knowing when to use each one separates high scorers from average performers. System 1 is fast and automatic. Pattern recognition and illness scripts. Buzzword identification. seen this before in tuition. Rapid clinical triage decisions. The internal, this is bad, or this is a PE, instant reaction. This is system 1. And this episode is dedicated to how we cultivate this power. System 2 is slow and analytical, constructing comprehensive differentials, analyzing complex data sets, comparing probabilities methodically, reading long question stems carefully, considering rare exceptions and edge cases. The truth, step 3 doesn't tell you. High scores live in system 1 as much as possible. Average scorers get stuck, forcing system 2 on every single question. Step 3 is a grueling 7-hour high-volume examination. If you use slow, deliberate thinking on every question, you will burn out cognitively by hour 4. You need automation. What is automation in medical learning? Automation is learning. In learning means turning conscious knowledge into subconscious intuition. It's the transformation that occurs when information moves from your working memory, which requires active effort to access, into your long-term memory as an automatic response pattern. When knowledge becomes automated, it's no longer something you think about deliberately. It becomes something you just know instantly, requiring minimal cognitive load to access and apply. Think about how you learn to drive a car. At first, every action required conscious thought. Check mirrors, adjust speed, monitor distance. Now, you do all of it automatically while holding a conversation. That's the beauty of automation. That's automation. The same principle applies to clinical reasoning, and it's the secret weapon of high-performing physicians. Crashing patient with fever and hypotension, automatic thought, sepsis, fluid, cultures, antibiotics, now. ST elevation on EKG, automatic thought, STEMI, activate cath lab immediately. Neck stiffness and fever, automatic thought, meningitis, LP, and antibiotics, STAT. This is automation in its purest form. Pattern, diagnosis, action. With minimal cognitive load. And step 3 is specifically designed to reward this type of clinical reasoning because it mirrors real-world practice. The 3 stages of automation development. So how do we develop that? Since it's a very powerful tool and it's a very powerful way of addressing step 3 and even gaining clinical expertise, automation does not happen overnight. It develops through a predictable, reproducible process. The same way muscle memory forms when you learn any physical skill, just like physical skills. Understanding these 3 stages helps you strategically design your study approach to maximize pattern recognition, speed, and accuracy. Each stage builds upon the previous one, creating increasingly robust neural pathways that fire automatically when you encounter familiar clinical scenarios. And I think those who are familiar with the neuroscience behind how you learn, you know that we are actually creating neural pathways that start as weak and get stronger as we repeat the information and they expose the brain to the same information. Okay, so that's what we are doing by studying. What are these 3 stages? First of all, stage 1 is exposure. You encounter the same pattern repeatedly through deliberate practice. Tearing chest pain appears in a question after question, always pointing toward aortic dissection. Worst headache of life consistently signals subarachnoid hemorrhage. Clear lungs plus pleuritic chest pain reliably indicates pulmonary embolism. The repetition begins rewiring your brain, creating stronger synaptic connections each time you see the pattern. Stage 2, familiarity. The pattern becomes instantly recognizable, like seeing a familiar face in a crowded room. You no longer need to consciously recall what does tearing chest pain mean. Your brain simply knows. The pattern triggers an immediate recognition response. This is when you start feeling confident during practice questions because your brain is starting to work for you automatically. Stage 3, automatic response. You no longer need deliberate, effortful reasoning. Your brain jumps directly from symptom cluster to correct diagnosis and appropriate action. Pattern, diagnosis, action. Remember these 3 steps. This is the holy grail of clinical reasoning. Pure automation. And that's our goal, by the way. We want this automation to happen. At this stage, you are not thinking through the question. You are simply recognizing the pattern and executing the learned response instantly. This is why buzzwords matter so profoundly. They are pre-packaged patterns your brain can store as cognitive shortcuts, heuristics. And shortcuts equal speed. Speed equals energy conservation. During a marathon exam, 7 hours. Energy conservation at hour 5 equals mental clarity when it matters most. This is the path to a higher score. Let's go over some patterns. Pattern 1, STEMI recognition and management. The buzzwords that should trigger instant recognition: crushing or pressure like chest pain radiating to the left arm, jaw, or neck, diaphoresis, ST segment elevations on EKG, new left bundle branch block, associated nausea and shortness of breath. Number 1, recognize the pattern. System 1 fires. This is a STEMI. Immediate action, aspirin, cath lab activation. Time matters. Door to balloon under 90 minutes. This is one of the conditions that are time sensitive. Any delay means worse prognosis or worse outcome. Automated clinical decisions. The minute or the moment you see this constellation of symptoms, your system 1 should fire instantly. There is no overthinking, no extensive differential building, no hesitation. The pattern triggers the action. Activate the cath lab fast. This is exactly how you will handle this scenario in real practice, and it's exactly what step 3 expects you to do. Pattern 2, pulmonary embolism. Cardinal buzzwords: sudden onset of dyspnea, pleuritic chest pain, clear lung fields on exam, hypoxia out of proportion to findings, risk factors, recent surgery, immobilization, pregnancy, malignancy, oral contraception. The critical distinction: stable patient, CT pulmonary angiography to confirm the diagnosis. Unstable patient, start therapeutic heparin immediately. Don't wait for imaging confirmation. This is where System 1 handles pattern recognition, and System 2 briefly steps in only to assess hemodynamic stability. This is where System 2 is needed for this critical decision part. Automated decision tree. Your brain should process this automatically, recognize PE patterns instantly, quick stability check, which includes mental status, stable CT pulmonary angiography, then anticoagulation. Unstable anticoagulation now, then consider thrombolytics as well. The key insight: clear lungs with sudden dyspnea is a buzzword combination that should make PE jump to the top of your differential instantly. In pneumonia or heart failure, which are other causes of shortness of breath, lung findings are prominent. In PE, the lungs often sound distinctively normal, creating that characteristic mismatch between symptoms and exam findings. Pattern 3, sepsis or septic shock, the pattern that cannot be missed. Sepsis is one of the most time-sensitive diagnoses in all of medicine. Every hour of delay in treatment increases mortality significantly. This is why automation is absolutely critical. Your brain needs to recognize this pattern and trigger immediate action without any hesitation or deliberation. Step 3 will present sepsis in various disguises, but the core pattern remains constant or consistent. Buzzwords for instant recognition: fever or hypothermia, hypotension, unresponsive to fluids, tachycardia, altered mental status, lactate more than 2 millimoles per liter, white blood cell abnormalities, known or suspected infection source. Immediate IV fluids resuscitation, which is usually 30 ml per kilogram crystalloids within the first 3 hours. Obtain blood cultures before antibiotics, but don't delay treatment. Broad spectrum IV antibiotics within the first hour, which we call the golden hour. Obtain lactate, initial and repeat if abnormal. It's a means of monitoring. And vasopressors, after you are done with your IV fluid resuscitation, if the patient is still hypotensive, pressors now are needed. So this is a cascade of interventions that you need to immediately implement to save the patient's life and tissues or organs. Don't debate, don't hesitate, don't wonder if maybe it's something else. The sepsis pattern should trigger pure, immediate automation, which is recognize fluids, cultures, antibiotics. No hesitation. This bundle of intervention needs to happen fast, and your System 1 response should fire the moment fever, hypotension, and potential infection source. Meningitis, this is another pattern that people need to recognize. Classic triad passwords: fever, neck stiffness, altered mental status, photophobia, positive Kernig's sign or Bodunski's sign. The decision algorithm: the focal neurological deficit. If focal neurological deficit present, then CT head first, then lumbar puncture, then antibiotics. By the way, in reality, you don't really wait for lumbar puncture before ordering your antibiotics. Usually treatment is what saves lives, not testing. The lumbar puncture is a test. So yes, it's preferable if you can do it immediately, quickly, while you are starting your process of giving antibiotics, but antibiotics are the lifesavers, the intervention. If no focal neurological deficit, lumbar puncture immediately, antibiotics, and don't wait for results if highly suspicious for the condition. The key, never delay antibiotics while waiting for LP or imaging in a patient with high suspicion of bacterial meningitis. So when I say decision algorithm, this means I engaged my system 2 thinking for a little bit. Here, there is a part of the algorithm says, if there is focal neurological deficit, you need to have imaging before doing LP. If no, then you can proceed for LP. System 1 should handle the pattern recognition instantly. Fever plus neck stiffness equals meningitis until proven otherwise. System 2 only needs to engage briefly to determine if there are focal deficits that necessitates imaging before LP. This is a perfect example of how both systems work together efficiently. Fast recognition, brief analytical check, then immediate action. Your brain should not hesitate on this pattern. You see? It's minutes. You need to do that in minutes. Aortic dissection. That's another pattern that's important to recognize. High stakes pattern recognition. Aortic dissection is one of the most rapidly fatal conditions you will encounter. Mortality increases 1 to 2% per hour if untreated, just like sepsis. Bad. This makes it a perfect candidate for automation. You need instant recognition followed by immediate protocol-driven action. The buzzwords are distinctive enough that missing this diagnosis is unacceptable. And step 3 knows it. This pattern absolutely must trigger your system 1 response without any delay. The buzzwords you cannot miss: tearing or ripping chest or back pain, pulse deficits between the extremities, blood pressure differential between arms, widened mediastinum on chest x-ray, history of uncontrolled hypertension, Marfan syndrome or connective tissue disorders. So recognize the pattern: tearing pain, pulse deficit, dissection. Control heart rate. Heart rate control has a priority over blood pressure control, by the way, when you are dealing with acute aortic dissection. IV beta blockers first, before blood pressure control, then blood pressure control, and the target is systolic blood pressure between 100 and 120, as low as you can get. Confirm the diagnosis after you start your intervention. First, you need to do the heart rate control and the blood pressure control, then confirm the diagnosis. The gold standard is CT angio. Definitive management is surgical versus medical, depending on the location of the dissection. So here, the critical automation principle, the word tearing in the stem is or should make your brain light up like a Christmas tree. This single descriptor is pathognomonic enough that it should trigger immediate suspicion for dissection. Combined with pulse deficits or blood pressure differential, your system 1 should have already selected start beta blockers and get CT angio before you finish reading the question. This is not guessing. This is trained automated clinical reasoning. Okay, so how to look at this whole system thing, buzzwords and patterns? Buzzwords as system 1 cognitive activators. There is a secret that transforms your understanding of buzzwords entirely. They are not simply clues embedded in question stems to help you. They are cognitive activators. Triggers specifically designed to fire your system 1 pattern recognition system. When the NBME writes tearing chest pain, they are not just describing symptoms. They are activating the illness script for aortic dissection that you have stored in your subconscious through repeated exposure and practice. By the way, system 1 resides in the subconscious. Okay? The conscious one is system 2, the slower, deliberate, analytical one. So what's the benefit? The benefit of using as much as you can system 1 rather than system 2 lies on energy conservation. System 1 uses minimal cognitive resources compared to system 2. Mental clarity. Automation frees your system 2 for complex questions that truly need it. I'm not trying to take system 2 out of the equation. I'm just telling you to use it sparsely so that you use it when it's really needed. Exam endurance. Reduced fatigue means better performance in hours 5 to 7. Speed. Instant pattern recognition saves critical seconds on every question. Time management is one of the problems. Higher accuracy. Pattern recognition reduces errors from overthinking. Okay? Think about it strategically. Step 3 contains straightforward pattern recognition questions. Complex multi-step management scenarios, ethical dilemmas, and biostatistic calculations. All this is included in step 3. You want to automate the straightforward questions completely, burning almost zero cognitive energy on them. This preserves your mental resources, your system 2 capacity for the questions that genuinely require careful analysis, the ethics questions with no clear right answer, the biostats calculations, the multiple step management of complex patients with multiple comorbidities. The strategic advantage, buzzwords equals less cognitive fatigue. Less fatigue means more clarity in the final hours. More clarity means better score overall. This isn't about finding shortcuts to avoid learning medicine. This is about learning medicine in the exact way your brain is designed to function in clinical practice. You are not gaming the system, you are optimizing how you think. So one might ask, so how do we achieve this automation thing? Knowing the theory of automation is valuable, but implementing it requires deliberate strategic practice. Here is your step-by-step training protocol to transform your pattern recognition from conscious effort to subconscious automation. From working memory to long-term memory and subconscious level. This approach is based on cognitive science research about how the brain develops expertise and automaticity in complex domains. Healthcare is as complex as they come. Number 1, build pattern flashcards. Create flashcards with pure patterns, no long explanations, no pathophysiology essays. In the front, symptom clusters, 2 to 3 key buzzwords. In the back, the diagnosis and the immediate action. Example, tearing chest pain plus pulse deficit. In the back, it will be aortic dissection. The action is IV beta blockers and CT angio. The shorter and more distilled the pattern, the faster it automates. Drill daily, fast reps, small sets. We are talking, this is the gymnasium terms or terminology, but we'll use it here. We said before, training your brain or this automation system is like training for physical skills. Your brain automates the speed, not exhaustive detail. Review 20 to 30 pattern cards daily, forcing yourself to answer within 2 to 3 seconds. If you can't answer instantly, the pattern isn't automated yet. The goal isn't to study for hours, it's to create frequent, rapid-fire exposure that train instant recall. Use micro scenarios. Practice with 1 to 2 line clinical scenarios instead of full-length vignettes. Example, 45-year-old male with sudden onset worst headache of life and nuchal rigidity. Your brain should fire subarachnoid hemorrhage, CT head, LP, if negative. Short cases strengthen pattern recognition better than long stems because they isolate the core pattern. Practice buzzword extraction. Now, this is beyond just practicing what's available. You need to create your own buzzwords. Okay? When doing practice questions, read the step fast on your first pass. Ask yourself, what are the 2 to 3 buzzwords here? What pattern is being signaled? Often, you can identify the answer from the first few lines. Then go back to read carefully to confirm. This trains your brain to recognize patterns before getting lost in extraneous details. Okay. The first quick reading, we call it scanning. If you are an avid reader, you know what scanning the page is or scanning the chapter is. Quick read to pick up the big things or the idea behind the article or the chapter. Then you come to read it more deliberate, more in details, and for more time. So scan first, then, and during your first scan, try to pick up if there is any buzzwords. Okay? And this training should improve your intuition. Okay? After sufficient practice, your system 1 will start giving you strong gut feelings about answers. And gut feeling is just a lay term for intuition. And that's what we are trying to strengthen here. Intuition is actually your system 1 at work. Okay? Don't dismiss these as mere guessing. Intuition is compressed experience. This is experience. This is how you develop experience. If you live in the ER and you see things every day, this is a form of practice and this is a form of experience. And you are actually training your system 1 or the intuition. If you have drilled the patterns, your first instinct is usually correct. Second guessing and overthinking are where errors creep. Try to trust it. The power of pattern recognition. Your brain is a pattern recognition machine. Arguably, the most sophisticated pattern machine or matching system ever created. Of course, it's a fantastic machine, actually. Evolution has optimized it for exactly this type of rapid automatic decision-making in complex environments. Your job as a medical student isn't to fight against this design, it's to train it deliberately and leverage its power strategically. Buzzwords aren't shortcuts for people who don't want to learn medicine. They are how medicine actually works in real practice. They represent the bridge connecting your conscious study efforts, System 2 learning, to your automatic intuition, System 1 performance. Once you successfully link them through deliberate practice, Step 3 transforms from an overwhelming endurance test into something faster, cleaner, and far less mentally exhausting. It's a 2-day exam, 7 hours a day testing. And 80% of the questions have clear patterns. Okay? Most questions reward instant pattern recognition over deliberate analysis. And you are actually saving time when you use or utilize this more. 2 to 3 seconds per question saved. You will end up saving 20 plus minutes throughout the exam. Pattern recognition isn't about memorizing lists. It's about training your brain to see what expert clinicians see instantly. It's about developing the clinical intuition that makes you not just a good test taker, but competent, efficient physician who can make critical decisions under pressure. This is your superpower. Train it. Let's put a more concrete action plan so that you get out of this episode with a plan to train your intuition. Pattern diagnosis action. That's how we want you to handle these questions. You now understand the cognitive science behind clinical reasoning, the 5 critical patterns that must be automated. We talked about them, the clinical cases we discussed, and the training protocol to develop instant pattern recognition. The question now is simple. Will you implement this knowledge? Transformation requires action, and action requires a concrete plan. Let me give you one. Number 1, identify your core 20 patterns. Start with the 5 patterns covered today, the STEMI, PE, sepsis, meningitis, and aortic dissection. Then add 15 more high-yield patterns from your weakest areas. Create a master list. I usually tell people, have a bank of things, bank of resources, okay? This is a bank of patterns, okay? Develop it and build on the same idea. Simple design of the pattern with simple response to the action. Okay, this is how you train. Remember the flashcards? This is step 2, actually, of this plan, is to create pattern flashcards. And we said 1 card per pattern, 2 to 3 buzzwords. The back should include the diagnosis and immediate action. No explanation, nothing fancy, no details, just pure distilled patterns designed for speed. That's the idea. Daily 10-minute drill. Every morning, drill through your pattern cards as fast as possible. You read the pattern, you need to recognize the diagnosis and know what to do, the action. Force yourself to answer within 2 to 3 seconds. This is training for speed, not comprehension. Practice buzzwords extraction on question banks. During practice questions, read each stem quickly first to identify the core pattern. Then read carefully to confirm. This trains your brain to see patterns before getting lost in details. Then the final step is to trust your system 1. You have been training, you have been practicing, give it a chance. Trust it. After 2 to 3 weeks drilling, start trusting your initial instinct on pattern recognition questions. Your intuition is trained expertise. Honor it instead of overthinking. Then train it until it becomes an instinct. Remember this fundamental truth. Better pattern, diagnosis, action. This isn't a gimmick or a shortcut. This is how expert clinicians think. This is how emergency medicine works. This is how you will practice medicine for your entire career. Step 3 is testing whether you can think like a physician, not whether you have memorized the textbook. Train your pattern recognition until it becomes instinct, and your score will reflect the physician you are becoming. Your brain is ready. Your patterns are learnable. Your automation is achievable. The only question remaining is, will you commit to the training? Start today. drill daily, trust the process. Your future self, the one walking out of the testing center with confidence, will thank you for the work you put in now. You have got this. Thank you for being with me. Please prescribe to the channel. It's a new growing channel, and I will continue providing videos like this to help you with your upcoming Step 3 exam and to help medical students in general gain these clinical reasoning directions and processes, because I'm really interested in clinical reasoning and clinical processes. Thank you. Appreciate it.